Hello, hello, hello. Hello, chickens. Welcome to my channel. If you don't already, then please subscribe, ring the bell so you don't miss any videos. And if you like this video, hit the like button. I'd appreciate it. Today's video is going to be all about a chronic health condition called gastroparesis. Unfortunately, it's another condition that I live with daily. And it's also another one that a lot of people haven't heard of and aren't aware of. So, I thought I'd try and do my bit to raise some awareness by doing this video. So, gastroparesis is a chronic condition. There's currently no cure for it. Gastroparesis is where the stomach becomes paralysed and therefore it doesn't empty itself in like a normal way. So food takes a lot longer to move through the digestive tract and through the stomach into the small intestine. You can probably hear mine now. That's probably because I've just had one of my milkshakes and yeah, it's playing up now. Typical, but the irony, hey? Why does it occur? It's thought to be a problem with the nerves that control stomach emptying. So therefore we eat the food, but the nerves don't get the signals, so the stomach doesn't empty. Damaged nerves mean that the muscles might not work properly in the stomach, therefore slowing down the movement of food and leaving it paralysed. So what are the symptoms of gastroparesis? Symptoms that I'm going to list can come and go. They can be mild, they can be severe. Everybody is different. So some of the symptoms are a feeling of fullness when eating and after eating only a small amount. Now for me, like literally, I can be dead hungry and then I'll eat like a tiny bit of food and I'm like, no, I'm so full. I feel like I'm actually full, like to here. I know that might probably be impossible, but I genuinely feel like I'm like this full. I'm like, I cannot have another mouthful of anything, not even a drink. Nausea and vomiting. I guess if the food's not going anywhere and it's just sort of sat there, and then yeah, you're gonna feel sick, and quite often I do throw up, unfortunately. Loss of appetite. Yeah, if you're not hungry, you're not gonna get the food in, are you? And then when you do eat, sometimes you vomit it back up. Which then leads me to the next symptom, which is loss of weight. Because if you're not getting the nutrients and the vitamins that you need in your body, then you're going to lose weight. But that's not for everyone. My weight fluctuates massively. Bloating. So I know I'm not skinny, but some days I can wake up and my tummy is quite flat, and then I could have something to eat or something to drink and my stomach will go and I literally look like I'm about 8 months pregnant. I'm like, where did this come from? And accompanying that bloating is quite often abdominal pain and discomfort. So I'm there with my hot water bottle and stuff, do what I can to try and help myself. But yeah, if you've got distension in your stomach, then of course it's going to be uncomfortable and cause pain and heartburn. It's going to occur from the vomiting, the nausea. If your stomach's not emptying properly, then you can get build-up of acid, which then can lead to heartburn. And like I said before, everybody's different, so no two people are exactly the same. For me, I have days where I can eat bits and bobs and I can sometimes have a meal. Other days I have to literally just rely on having my, excuse me, that is another thing. I burp so much, it's horrendous, but it is part of the medical condition because of the build-up of like gas and stuff. So if you are experiencing any of those symptoms, then first things first, you really should go to your doctor and get it checked out. If it's ignored, then complications can arise. There can be complications of gastroparesis. Probably the most common one is dehydration. Obviously, if you're not getting the food, you're not getting the fluids in there, and then you're vomiting or whatever, and then you can get quite severely dehydrated. I've had it before quite a few times. It's led me to have hospital stays. I know other people with gastroparesis who have been admitted to hospital for dehydration. And it's not just being a bit thirsty, like dehydration affects everything. It affects like your sodium levels and your enzymes and things. So it's really important to try and stay hydrated. Malnutrition, again, you're not eating, or you're not getting, even if you are eating and then your stomach's not absorbing the nutrients and things, then you're going to end up malnourished. Gastroesophageal reflux disease, so a bit like I said earlier, stomach acid can build up because it's not like passing through, so it can then come back up and you can lead to esophageal reflux. Blood sugars can be unpredictable as well. In a lot of cases of gastroparesis, the actual cause isn't known, and this is what is called idiopathic gastroparesis. Some of the known causes of gastroparesis are poorly controlled diabetes and surgery complications. Now, most surgery complications are from stomach surgeries like gastric band surgeries, etc. Other things that can cause gastroparesis are medications. Opiates are known for slowing down gastric emptying. Parkinson's disease, scleroderma, and amyloidosis. So these are all other things that are known causes. Diagnosis. So how do you go about getting diagnosed with gastroparesis? So, like I said before, first thing to do is to go to your GP or your family doctor. Express with them your symptoms and your concerns that you've got. What the GP might do then is refer you to a specialist at a hospital. And the hospital can do lots of different tests and things to diagnose or find out what the problem is that's causing your issues. There are multiple different tests that can be done to diagnose gastroparesis. I'm going to talk you through a couple of them now. I've had loads of them myself, so I'll be able to talk from first-hand experience. So, a barium X-rays. What this is they give you like a liquid that contains a tiny bit of barium, and you swallow it. The barium then will show up in an X-ray and can show the passage and how long it takes to get through your body. So you drink the drink, and then I think I had to go for like 10 minutes, every 10 minutes for like the first hour, and then I think it was like every half an hour, and then every hour. It's not the nicest of tests. It's a bit like the drink itself was a bit like chalky if I remember, but you know, it made me feel a bit sick. It was quite filling, but have to go through these things in order to find out what's going on. Gastric emptying scans. So this is what I had to do was you normally have to eat something like porridge or scrambled eggs, and you'll have a little bit of radioactive, and the food will be slightly radioactive, only a tiny bit. What happens then is you have to go and get scanned again. I think it's like after 10 minutes again, and then after half an hour, after an hour, etc. And after 4 hours, if 10% or more of the food is still left in your stomach, then that's normally when a diagnosis of gastroparesis would be made. Another test that is quite common is a wireless pill that you swallow, and you swallow it and it sends information back about the transit of your gastric emptying. And another thing they might do is an endoscopy. So it's where you have a small camera that goes down your throat. What they'll probably be doing is to check for other conditions and make sure there's nothing more sinister going on. So as I said earlier, there isn't a cure for gastroparesis. A combination of medical treatment and dietary changes are often used. Now obviously they can't cure the conditions, but they might be able to help control it so you have a better quality of life. Some tips that I've personally been given are to eat smaller, more frequent meals. So personally, I don't really eat like a large meal. If I was to do that, then I know that it was going to make me feel sick, get a lot of pain and stuff. So smaller meals throughout the day. So I don't mean like eat 6 roast dinners or whatever. I mean like just small meals, like a bit of soup or whatever. Yeah. Thing with your stomach is it goes to sleep really easily. So the key is to try and like keep it awake. Soft and liquid foods sometimes can help as well. So I have special shakes that were prescribed to me from my dietitian, and these are them. They're called Vital 1.5 kcal. I don't know if you'll be able to see because my camera's very good, but all of these here are all the different like minerals, nutrients, vitamins. You're so cute. Go ahead then. Come on then. We have a visitor. This is Albus Dumbledore. He's here to say hello. Yeah, where was I? So yeah, this has got all these different vitamins, minerals and things in it. And you can actually survive off these if you drink enough of them. Having one of these is like equivalent to having a roast dinner or something. It's crazy. and there are 300 calories just in this little 200 milliliter box. So I don't think you can buy these from the shops because they are for special medical purposes. They come in 3 different flavours. I have vanilla, mixed berries and cafe latte. And they're partially hydrolyzed, complete balanced nutrition with sugar and sweetener. So basically they're already partly digested, so it's a lot easier on your stomach. So I can have these, and they do make me feel a little bit sick, I'm not gonna lie. But better than me eating food which is going to be stuck there and then make me be sick. There are other like nutrient drinks and things, so there's like, is it compact, I think, 40 sips. I've tried all of them really. Those are the ones I get on best with. But yeah, talk to your gastro doctor or dietitian or your GP and they might be able to sort you out with something. If I do feel like I can eat a bit of food, but I always avoid like a big meal or red meats and things because they're harder to digest. I'll try and stick with things that are quite easy, like mashed potato. This might sound like a really obvious thing and I might sound like I'm being patronising, but I'm not. But make sure you chew your food. Chew, chew, chew. Sound like a bloody train. Chew, chew. The more you chew your food, the easier it is to get through your stomach. Take your time when you eat. It takes me ages to eat. I'm always like the last person there. But I have to do that, so. And drink with your meals. It's so important to have a drink with you whenever you're having a meal, and preferably not like a fizzy drink, preferably water. Medications. There are some medications that can be prescribed to try and help with gastroparesis. One of them is domperidone, which is one that speeds up your stomach emptying process. Another is erythromycin. That is actually an antibiotic, and again it speeds stomach emptying. I was on that for long term. I think I was on it for about 6 months at one point. And antiemetics, so anti-sickness. So for me, what works best is cyclizine. There's things like ondansetron, metoclopramide. Again, if you speak to your GP or your doctor, then they'll be able to help you out with that. There is limited evidence on some of the medications though. So it's really important that you outweigh the risks and the benefits with your doctor and you talk them through to decide, because obviously you're going to get side effects and things. So developments are being made all the time. Something that is still fairly new is a gastroelectrical stimulator. Like I say, it's fairly new and it's not funded by a lot of NHS places here in the UK at the moment. So the gastroelectrical stimulator is a little device that's inserted, and what it does is it delivers impulses to try and stimulate the muscles that control the food passing through your stomach into your small intestine. Like I said, it's quite new and it's currently varied in effectiveness. Everybody's bodies are different as well. Now the treatment is botulinum toxins. I think that's how you say it, because I Botox, yeah. And what they can do, they can inject it into the little valve between your stomach and your small intestine, and what it does, it relaxes the valve so that then it opens longer and it's got more time for food to pass through. In more severe cases of gastroparesis, sometimes people need feeding tubes. There are different types of feeding tubes. So there's temporary ones and there are permanent ones. Temporary ones are NJ or NG tubes, which go up your nose. Tiny little tube goes up your nose and down into your either your stomach or your small intestine. That can sometimes be done with a camera, or they'll x-ray it to make sure it's in the right place. And then food in the form of liquid food like these are pumped through, and that is how you absorb your nutrients. More permanent feeding tubes, things like a PEG J, which goes directly into your jejunum through a little insert in your abdomen. And in the really severe cases, sometimes TPN is needed, and that is where you're fed through your veins into your heart. So I hope that that's given you a bit of knowledge about gastroparesis. If you've got anything that helps you and I've not mentioned it, please pop it in the comments below. Also, if you do have gastroparesis yourself, then let me know as well. It's nice to be able to talk to other people with the conditions that you've got, especially when they're rare or rarely diagnosed, I would say. Remember, awareness is key. So many doctors haven't heard of these conditions. Gastroparesis often comes arm in arm with Ehlers-Danlos syndrome, POTS, and these other rare conditions. If there's any other videos you'd like to see or anything you particularly want me to speak about, please let me know in the comments below. Please give my video a like if you enjoyed it or if you've learned anything from it. And don't forget to subscribe. I would really appreciate it. Anyway, love and hugs, and hope you have as pain-free day as possible.